This project is titled Intravitreal Injection Pain Reduction through Timely Administration of Lidocaine in the Eye Clinic. In terms of our introduction, there are numerous procedures that require interventional treatment mandating intravitreal injections. It's not surprising that intravitreal injections, so shots around the eye, can cause discomfort, anxiety, pain, etc. among patients, even patients who don't have discomfort with other types of invasive procedures. There are specific guidelines regarding the timing of lidocaine administration, the dosage of the administration, and then the follow-up depending on the pain reported by the patient. However, we were uncertain if they were being all accurately followed. The lidocaine is crucial in reducing this pain and also reducing the anxiety and increasing compliance by the patients before the intravitreal injections are given, as the patients are sure that there will be significant pain reduction and they won't have to worry about that. So we aim to quantify the individual rates of three factors, the timing, dosage, and follow-up, as we discussed before, and see how good the compliance was. In terms of our methodology, we asked providers to record information regarding these three factors, and then we used the de-identified data that they provided to see if they were in compliance with the American ophthalmology protocols. We feel as though the American ophthalmology protocols are the highest quality guidelines and the ones to be followed by all American ophthalmologists. We looked at a total of 75 encounters, and of note, we did not tell the ophthalmologist the guidelines prior to the experiment because we felt that this might negatively affect the generalizability, the quality, and increase the bias present within the results. So in terms of the results, 34% of providers were in compliance with the timing, 65% were not, 93% of providers were in compliance with the dosage, and 6% were not, and then finally 85% of providers were in compliance with the follow-up and 14% were not. So timing was the most difficult things for providers to be in compliance with, and the primary issue that we identified, though we felt that all of the areas could use improvement to get to 100% for the best outcomes, as the studies by the American Ophthalmology Association has shown. In general, we showed relatively high compliance besides the one area that we talked about, and we hypothesized that this is because most patients require the same dosage every time, so there aren't that many different dosages. Obviously that will increase the compliance because there's not that many alternatives. However, the timing is very different depending on the specific patient, and that can certainly have an effect on compliance. So we hope that by informing providers about the guidelines and increasing awareness about this, we can close the gap here between the book and the practice and bring awareness to this issue as much as possible. Thank you.